retire Monday after 33 years of service with the city.
If you have a child with a peanut allergy, then you know how dangerous it can be even to send them to the cafeteria. But based on updated research, there could be a way to prevent a peanut allergy in your child. And now more local doctors are urging you to take this newer approach. Michelle Backus explains.
You take this boot thing off and...
Perfect. Meet Thomas Caleb Hughes. Since the day he was born, he suffered from eczema. Eczema is a skin condition where patches of skin can become inflamed, itchy, red, and cracked. Little did his parents know this was an early sign of an allergy. And at 11 months old, Thomas was diagnosed with a severe peanut allergy.
It just never really went away. We tried different medicines and different creams, and we saw his pediatrician. And finally, when he was about 11 months old, they did a bunch of blood tests, and they called later that day and said, he has a pretty high test for peanut allergies. You need to get EpiPens, and you need to go see an allergist.
Yet, even though Thomas has a severe peanut allergy, his mother, Nikki, is taking a unique approach with her next child. She's going to introduce them to peanuts within the first year of their life. This is all part of a new era of clinical guidelines, citing that there is strong evidence that early introduction of peanuts could actually prevent the development of a peanut allergy in infants at high risk, just like Thomas. This method allows immune system cells in your gastrointestinal tract to become tolerant of the foods they are given.
So based on this, the guidelines, completely changed. 360 degrees. So now we're telling parents, don't wait, introduce.
And the data only seems to get stronger. Just last month, the American Academy of Pediatrics furthered the idea of early introduction by updating an initial study from 2008, saying that instead of waiting until kids were at least 3 years old, you can start testing out foods as early as 4 to 6 months.
We do not want to lose this narrow window that we have, because once the child develops the peanut allergy, then the likelihood of the child growing out of the allergy is small.
Nikki believes her child will be at high risk, so she will be under Dr. Rafeeq's supervision as she tries early introduction. Some factors that make your child high risk include eczema, other allergies already present, or a family member with a peanut allergy. If this sounds like your child, it's best to do it in a controlled setting with a blood test or a skin test. If your child is low risk, it's okay to try early introduction at home. Nikki hopes her second child does not have to suffer like Thomas does. While she worries about his safety constantly, Thomas will tell you he knows how to work an EpiPen and has no problem telling people what he is allergic to.
It didn't really hurt.
No, it wouldn't hurt, right? Because it would be, if it was a real needle, it would be a really tiny needle, and you'd get the medicine that you need.
Reporting in Toledo, Michelle Backus, WTOL 11.
Tonight, there'll be a meeting to discuss the future of the Sisters of Notre Dame site over in West Toledo. The school